I'm Dr. Meena Venkatraman. I'm a consultant pediatrician at Cloud9 Hospital, Varthu Road and Old Airport Road. Croup is a viral respiratory illness which is usually seen in young infants and children. The usual age group is from 6 months of age to 3 years. It's very unusual to see a child older than 6 years of age present with this. It is usually caused by a viral infection. A bunch of viruses can cause it. Mostly it is the para-influenza virus which causes this infection. The typical symptoms of croup are hoarseness of voice. The child would have a very hoarse voice and the barking cough which can sound like a dog barking. And the third symptom is what is called as stridor. Stridor is a high-pitched noisy breathing which is audible, and these form the classic triad of croup. Croup is usually because there is inflammation and narrowing in the upper airways. The upper trachea or the windpipe and the voice box, the larynx, is inflamed and narrowed because of the viral infection, which leads to the classical symptoms that we see in croup. Most cases of croup are seen in the winter months and they are usually self-limiting. Even though the noisy breathing causes a lot of anxiety to parents, majority of the croup cases are mild and they spontaneously resolve. Usually the treatment would depend on the severity of croup. If the child has mild croup, treatment is only supportive and symptomatic care at home would help. We suggest that the child is given cool mist or mist air to inhale. So if the child has this bout of noisy breathing, you could open the window or the door and the child can inhale the cool night air, which will help relieve the inflammation in the airway. The other thing is mist, which is like the child has to be with the parent, cannot be left unattended. So the bathroom can be filled with steam from running a hot shower. The child need not be placed under the shower, but you can take the baby to the bathroom which has the steam and let the baby inhale it. That will also reduce the symptoms. Sometimes nebulization is also suggested. Home nebulization with hypertonic saline also helps. And also giving a lot of fluids, giving paracetamol if there is fever, and elevating the head end of the child would help relieve the symptoms. Diagnosis is only based on clinical symptoms. There is no need to run any blood tests or do x-rays to confirm the diagnosis. A small percentage of children would go on to have a little more severe form of croup, wherein they may have retractions, which is indrawing of the chest when they breathe, and high-pitched stridor might continue and their oxygen levels may drop. This would be a warning sign to immediately rush them to your pediatrician or to the emergency room for further management.